Welcome to Science Easy Tech channel. In this video, we are going to discuss about Microbiology 5 marks answer key. This is my part 3 video. In each part, I am posting one 5-mark question which have been asked from various previous university question papers from Dr. NTR or Dr. YSR University of Health Sciences. This video will be useful for Bsc Nursing students and post-basic Bsc Nursing students. So the topic of today's video is Rota virus, which was taken from August 2021 question paper from Bsc Nursing first year students. So this is my part 3 video. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Let's move on to the topic. Rota virus. Rota virus means it causes major diarrheal illnesses in children or infants in the world. It is the leading cause for diarrheal illness in infants, that is under 1 year of age. Adults also get infected because of Rota virus. Young animals like cows and piglets are also infected. So Rota virus outbreak of infection is seen mostly in November and April months. Rotavirus infection often spread in settings where many children are together, such as daycare centers, because the infection can spread from one child to other child through fecal-oral route. So rotavirus, it is a major cause of diarrheal illness which is seen in children. Okay. So the infection is more common in the months of April and November, and the infection spreads in areas where more children are together, like daycare centers and poor environmental sanitation, like that and all. So how the rotavirus is transmitted? So it is a viral infection. It is transmitted by fecal-oral route, that is from feces to oral route, and it is highly communicable diseases. So close person to person contact, poor environmental hygiene also can lead to this infection. So because of vector house flies also, it can spread from one person to other person. What is the incubation period? The incubation period is 1 to 3 days. That is, the entry of the virus and the appearance of the first sign and symptom may take place between 1 to 3 days. The large quantities of virus will be shedding in the feces in the first 10 days of infection. So the first 10 days of period is considered to be as highly infectable period. So the chances of communicability during the first 10 days is more. Amount of virus shed in stool is 10 to 100 billion virion per gram of stool infection. So amount of ingested virus required to cause infection as few as 10 infective virions. Even 10 infective virions also can produce a disease. So from 10 to 100 billion virions. So see how much virus has been shedding in the feces. So this is the structure of rotavirus. It was first reported in the year 1973. It belongs to the viral family Rheoviridae. Rotavirus has characteristic wheel-like appearance when viewed under electron microscope. See how the appearance is like a wheel. It looks exactly like a wheel. So it is a triple layered capsule. Okay, it is a triple layered capsule surrounding the RNA material. See here how the virus is. Okay, it is a triple layer capsule. See the structure of rotaviruses. So the rotavirus genome consists of 11 double-stranded RNA segments. So how many RNA segments are there in the middle? 11 RNA double-stranded segments. So only so you have rotavirus group from A to G. Rotavirus A, B, C, D, G, E, F and G. But only rotavirus A, rotavirus B and rotavirus C leads to infection in humans. Okay. So the vaccine gives protection against group A rotavirus vaccine, because group A only is causing more amount of childhood diarrhea, that is infants. It affects the infants leading to diarrhea. So to prevent childhood infection of group A, we are giving rotavirus vaccination, which is effective against group A rotavirus. The G type and P type define the serotype. There are two types of serotypes. What are they? G type and P type. So based on this, the vaccines are produced to promote the immune response. So I told G1P is the most common type of serotype. G1P8 is the most common type of serotype. So G1, G2, G3, G4 and G9, all serotypes are observed in the infection state. So what are the signs and symptoms? We all know diarrhea. The diarrhea will be non-bloody diarrhea, nausea, vomiting, dehydration in severe cases, fever, abdominal pain. Non-bloody diarrhea, nausea, vomiting, dehydration in severe cases, fever, abdominal pain. Why rotavirus infection causes diarrhea? Because the infection of the virus will be entering into the epithelial villi cells, causing cell destruction, decreased absorption of salt and water, and decreased disaccharide activity, leading to osmotic load in the gut. So this leads to diarrhea. So rotavirus induced gastrointestinal in children who are having immunodeficiency may cause persistent infections which may last for various weeks to months. So there will be non-bloody diarrhea, nausea, vomiting, dehydration in severe cases, fever, abdominal pain. How you will diagnose the rotavirus infection? So the rotavirus infection can be diagnosed by history collection, physical examination. Most children are admitted with severe diarrhea, so you will be testing for rotavirus. So the child's stool will be sent for enzyme immunoassay screening, and children with immunodeficiency disorders may be treated with specific rotavirus immunoglobulin preparation. So you will be giving rotavirus immunoglobulin preparations for children who are having immunodeficiency disorders. So for a rotavirus infection, the enzyme immunoassay you have to give, and children who are having immunodeficiency along with rotavirus infection, you have to give rotavirus immunoglobulin preparations. So next, moving on to other laboratory diagnosis, microscopy, electron microscopy to detect the virus in the stools. Other diagnostic methods include enzyme linked immunosorbent assay, that is ELISA, rapid antigen detection by ELISA of rotavirus in stool samples, and you will be doing genotyping. So how you will treat the rotavirus disease? As usual, since dehydration is there, you have to replace with fluids and electrolytes. Oral rehydration therapy, ORS solution should be given. Fresh fruit juices and soft drinks are not recommended due to their high glucose content, low sodium content and high osmolality. Then antibiotics you have to give, anti-secretory drugs you have to give to control the secretion and diarrhea, anti-motility drugs to decrease the intestinal motility, absorbance, and antiemetics. Sometimes nausea also you will be having, so you will be giving antiemetics also. Do not clear acute infection, but it prevents a reinfection from the virus. So these are all symptomatic management. Whatever I have told about fluid replacement, oral rehydration therapy, antibiotics, anti-secretory drugs, anti-motility drugs, absorbance and antiemetics or drugs which are given for symptomatic management. So infection control. So here hand washing is very important. Food preparation areas, everything should be hygienic. When you are changing diaper, okay, when you are preparing food, when you are disposing the diaper, when you are touching the toys, everything you have to wash your hands properly. Then hospital areas and clinics, again you have to hand wash during medication preparation, equipment when you are using an equipment for the child and you are taking it away, and patient care areas and all, go for adequate hand washing. Okay, so because this hand washing effectively stops the spread of the viruses. So there are two types of vaccines which are available. These two vaccines are oral live attenuated vaccines, that is rotavirus vaccines. So under this you have Rota-RIX, Rota-TEC, Rota-RIX and Rota-TEC. So Rota-TEC and Rota-Varix dosing. So Rota-TEC vaccine is given in 3 doses, but all 3 doses should be given within 32 weeks of age. The first dose ideally you should be given 2 months of age, second dose 4 months of age, and the third dose you have to give at 6 months of age. Then DRNTRUHS is given as a 2 dose that can be started when an infant is as young as 6 weeks old. The second dose can be given as early as 4 weeks later the first dose and must be given within 24 weeks old. So here suppose if you are giving at 4 weeks, the next dose should be given at as early as possible, that is as 4 weeks after that. So first dose if you are giving 4 weeks, then second dose you have to give at 8 weeks. First dose if you are giving at 6 weeks, second dose should be given at 10 weeks, like that. Or you can give like second month, fourth month, like that also you can give. So here there are 2 doses. RotaTech you have to give 3 doses and RotaVirus you have to give in 2 doses. So the caregiver or teacher and family roles re-educate the staff members and the family members to follow strict and frequent hand washing during diaper changing, toileting, food handling and sanitation procedures. Hope this video is clear for you all. So you know that what you should write for rotavirus infection. Thank you friends. Keep supporting to Science Easy Tech channel. If you like my video, please give a thumbs up, share and subscribe to Science Easy Tech channel. My previous videos link I have given in description box, suggested end card and iCard. Or you can watch our channel playlist for more nursing related videos as well as videos related to intermediate subjects in Tamil. Thank you friends. Keep supporting to Science Easy Tech channel.